A very warm welcome to Stoka's 7th Roundtable Discussion Session in 2021. I'm Dr. Aline Nassar, the CEO and Board Chairman of Stoka's Australia. The WHO defines person-centered care as empowering people to take charge of their own health rather than being passive recipients of health services. This care strategy is based on the belief that patients' views, input, and experiences could help improve the overall health outcomes. This approach emphasizes partnerships between patients, their families, and healthcare professionals. Over the coming hour, Karin J., our keynote speaker, will be discussing person-centered care in the post-COVID-19 era. Karin J. joined Planetree in 2012 and is the Senior Vice President for Global Services. Karin is working to expand the network of Planetree affiliates internationally and provide consultation to key stakeholders on the implementation of Planetree's relationship-centered model of care and international certification criteria. Prior to joining Planetree, Karin spent over 22 years working in the accreditation and international quality patient safety arena with the Joint Commission JCO and Joint Commission International JCI. Karin has been a contributing author on several publications focused on accreditation, patient-centered care, and patients' rights. She has served on ISCO's advisory forum on partnerships with patients, as well as on the advisory board for patient value in healthcare for the Economist Intelligence Unit. Currently, Karin serves on ISCO's Person-Centered Care Community of Practice, the Joint Commission's Patient and Family Advisory Council, and is an active volunteer with several nonprofit organizations. Karin holds a master's degree of Arts in Philosophy and Healthcare Ethics from Loyola University, Chicago, and a bachelor's degree of Arts from the University of Michigan, Ann Arbor. Karin, we are all very excited. So without further ado, and joined by everyone, I welcome you. The floor is all yours.
Thank you so much, Dr. Aileen. Thank you to you and Dr. Rana and your team at Stochos. It's really an honor to be here, a pleasure to meet some new folks and see some friends on this call. So thanks for joining. And also, I know that the timing, there was an attempt to accommodate myself this morning and many other time zones. So really an honor and a privilege to be here. And without much further ado, we'll go ahead and get started. Please don't hesitate to interrupt me at any time if there's something that is unclear or if you have questions. And we will have certainly ample time at the end of the presentation for questions and continued discussion. So as Dr. Aileen mentioned, we are here today to talk a little bit about person-centered care and what we think this is going to look like and what we need to focus on in the post-COVID-19 era. Unfortunately, we are not yet quite in that post-era, but looking forward with the opportunity for reaching that era in the near future, hopefully. So I'm sorry, my computer is getting a little ahead of me here. I wanted to first talk a little bit about the organization that I represent. I am with Planetree International, and we are a not-for-profit organization that is headquartered in the United States. We also have 6 international offices treating really the language part of where the respective offices are. So, for example, we have an office in Quebec, Canada, that works with any of our Francophone speaking affiliates. So those in France, in Morocco, and other French-speaking countries. We have an office in Brazil handling our Portuguese work. and 3 other offices in Latin America, handling various regions in Latin America. Those are located in Mexico and Colombia and Argentina. And then also an office in the Netherlands that handles our Dutch-speaking affiliates in Holland and Belgium, but also Germany and parts of Scandinavia and Latvia as well. We do work in 30 countries, so we are in every continent except Antarctica, and I'll get into a little bit more detail about that. But most importantly, I'd like to introduce you to our wonderful founder who is still with us today, Angie Chariot. That's a picture of her in the lower right-hand corner. And Angie, her story is that she unfortunately had a very significant illness when she was a young woman. This was in 1978, and she was hospitalized in a large, well-reputed teaching academic medical center in Northern California. And her condition was very difficult to diagnose. She presented with a fever and chills, aches, and eventually, unfortunately, was in a coma. So really, really ill. She was there for over a month and fortunately came out of her coma, but still faced communication from her medical team to her husband that were really disturbing things being said when she was fully conscious, such as, you may need to brace yourself for the worst. We're not sure she's going to make it. So make plans and make preparations for this. This was what her physicians were communicating to her husband at the time. So can you imagine being in that bed and hearing this type of communication? Also, she struggled along with the medical team to find out what was wrong with her. And at that time, of course, it was the pre-internet era. So really the opportunity to find out anything about her condition was very limited. So really, fortunately, Angie recovered and she made it her life's mission to change the face of healthcare delivery. She credits actually a few of her night nurses for treating her in a very different manner. They took interest in her as an individual and not as just a condition, and really asked her questions about what was important to her, what mattered to her. They learned of her interest in her philanthropic work, her deep dedication to her family, her deep dedication to Argentina, where she's originally from, and really rallied her to get better. So they were a driving force for night nurses in her recovery. Because of that, she wanted to really disrupt the movement in the United States and frankly all over the world for how healthcare was delivered, and wanted patients to be able to take an active part in their healing in a warm and nurturing environment, looking to personalize, humanize, and demystify the care process. So that was the foundation of Plaintree. And we are now started by one patient, powered by tens of thousands of different voices and affecting millions of lives, as I mentioned, really all over the world, but also across the continuum of care. So not only working in acute care, but behavioral health, long-term and aged care, and primary care as well. And we have one goal, and that is really to focus on driving quality. So when we think about our current state right now, our world has changed. However, quality and person-centered care as a driver of quality and safety has not. We see many situations where people were putting off healthcare completely or delaying healthcare because of the pandemic. People were scared and continue to be frightened still to go into the hospital. They're afraid to go into the hospital, even having a cardiac event, a stroke, or other very serious events. Routine cancer screenings have plunged. And of course, we are still seeing that many elective surgeries have been put off. About half of the public polled recently said that they had skipped or postponed medical care because of the coronavirus outcome. And also we were providing mixed messages to our patients and our communities. Messaging that said, stay at home, save lives, stay at home, stay safe. Yet also in the same messaging, don't delay your care. Please make sure you come in for those routine screenings. And if you're not feeling well, don't delay medical care. Trust that we will keep you safe. But the aim pre-COVID and now as we enter hopefully the post-COVID era in the near future remains the same. We want to make sure that we are providing better care for better health with lower costs and with a better culture as well.
Karin, if you don't mind, I think there's a connection issue because everyone's hearing the break in the voice from your end.
Okay, I am not sure how to fix that.
Now it's all right, but it goes into intervals where there's a lot of interruption and you break off. So maybe
I think stopping my video might be one way to help with that. So I will try that. If others have suggestions, I am totally open to them.
Now it seems fine. I think if we just go a bit slower, just when the interruption happens, it's less impactful. If it happens again, I'll let you know, but now seems to be okay.
Okay, and I'll shut off my video. That might help with the bandwidth as well.
Do you want to try keeping it on for now? If it happened again, then you'll probably switch it off.
Okay.
All right, thank you.
Sure. Oh, now it's not turning back on. Well, I will keep trying that, but we will keep moving. In terms of what our patients are facing, we really need to take stock of the current state. Patients are entering back into the medical world with many questions, concerns, and emotional issues at hand. So, for example, they're questioning if they're safe. Are they putting their own loved ones at risk? And what is the impact on healthcare if I seek care? And what is the impact if I delay care as well? In addition to that, there are feelings of uncertainty entering the healthcare arena after being gone for such a long time, feelings of vulnerability, of personal upheaval, and also, of course, fear. And then from a practical standpoint, we all see that folks are offered at this point, I think in most places, some version of telemedicine, but also a lot of questions around if the technology will be successful. Case in point, I guess, with what we're presenting today. Will it be reliable? Will I be able to manage it? And then other concerns for folks who are recently unemployed, if they can no longer afford care as well. So in terms of what we need to consider as we have patients and community members returning to our healthcare systems, we really need to make a very concerted effort to involve those folks in our decision-making processes. So really question, what dimensions matter to the community members right now in this era of COVID and hopefully coming into a post-COVID era? What can we do to make sure our patients feel safe and secure? And are we communicating clearly and with transparency with our patients and our community members? So making sure that our messaging is reaching the most vulnerable in the community, particularly important, as I know many of us have experience around vaccination efforts. If we are not asking for the perspective of our patients and our families, we're missing an opportunity to build trust and confidence with our community and our patients and families. So we want to make sure that we can build trust by partnering with our patients and families. And how do we go about doing that?
Karin,
We want to hear.
I'm sorry to interrupt. The connection is probably falling back again. Let's try, as you suggested, if you turn your webcam off and see if it gets any better.
Okay.
Thank you.
Thank you. And I apologize. I am sorry that that is happening. We want to make sure we engage with patients to hear firsthand the patient's concerns, family concerns, beliefs, and experiences. We also want to make sure that this is a reality check for assumptions and internal dialogues, and making sure that we are humanizing our strategy. So really coming back to what Angie Thiriet's first mission was with founding Plaintree, to humanize, personalize, and demystify the care experience, and make sure that your messaging is personalized to your audiences. Is it any better, Aileen, the sound?
It's much better, thank you.
Much better, thank you.
Okay, great. So in terms of the evidence base in engaging patients and family in the care process, there was a wonderful publication put out in 2017 by the National Academy of Medicine, really stating the case and also providing a framework for patient and family engaged care. And this great publication contains over 100 articles, one of the best bibliographies in terms of patient and family engaged care and making the case for that. I highly recommend that you download this paper. It's available on our website. And in terms of some highlights from this, we can see that patient and family engaged care results in better clinical outcomes and improved health outcomes. Also, improvement in the quality of all interactions, and adherence to treatment recommendations increases with patient and family engaged care. We also see that there's increased clinician job satisfaction and reduced burnout, so resulting in increased retention of employees, and also reported increases in physician well-being. So how do we go about this patient and family engagement, particularly in the time of COVID and post-COVID? We want to make sure that through any situation, even during a crisis in a pandemic, that we're honoring patient preferences. We want to look to how we can creatively involve family and friends, even in the time where we have widespread pandemic. Also, coming back to that opportunity to provide access to information, and then how we can co-design our efforts with our patients. So in terms of honoring patient preferences, we want to make sure we have every opportunity for patients to partner with us. So this first example is from one of our gold certified sites in Ireland, Hermitage Health. And upon admission, patients have the opportunities to really communicate to their care team different things that are very important to them. So really what they can cope well with, what bothers them, and then also timeframes about when they will be able to address certain issues in the future. Also an example from Merit Health, to make sure that the patients have goals for their stays and that their preferences in terms of their wake times, bathing times, exercise times, etc., are all respected. We want to make sure that we can bridge the gap with our patients between what they think they want and what we can learn with them through those critical conversations. Changing the conversations with our patients to be more informed and respectful. Seeking out faster but deeper engagements. And with those tools that we just profiled, that is an opportunity for that faster and deeper engagement. Seeking out a better quest for solutions and outcomes, and then gaining a greater understanding of the person, not the patient. So coming back to Angie's experience, really looking to the whole individual and not just a condition, in her case, a mystery condition that is presenting. So one other important component of how we can support our patients is making sure that we can empower family members. that we can structure a care partner program that allows a designated individual to be a part of the care process. Care partners can help in a whole host of ways, and this can include making meal choices, feeding, some bathing opportunities, providing care and touch, such as massage, application of lotion, helping provide emotional and spiritual support, and also, perhaps most importantly, being trained in how they can support the patient upon discharge. Sometimes this includes taking vital signs or being able to change wound dressing after discharge. This is an example of one of our structured care partner programs with Al Musa Hospital in the Al Hassa region of Saudi Arabia. They do a great job with this. Now, we have had certain restrictions that have been in place and in many places are still in place because of the pandemic. But really, as a patient advocacy organization, very early on in the pandemic, last May, we really rallied to try and address this challenging issue. How could we continue to have patients involved with family members supporting them in the time of the pandemic? So we have created, with a pop-up coalition of over 60 organizations from around the world, person-centered guidelines for preserving family presence in challenging times. I really encourage you to download this as well. This is readily available from the front page of our website, planetree.org, and recently released within the last 2 weeks. We also have an accompanying nurses toolkit for structured approaches and tools to maintain family presence. And this is really helpful to accompany this guide. So making sure we can reintroduce visitors, particularly those that are designated care partners, with the pandemic still going on, and keep everyone safe. So this coalition had endorsement from several organizations. Likewise, the Nursing Toolkit has endorsement from several organizations, really trying to move forward creative thinking around maintaining family presence. Third, we have access to information. So really coming back to that idea that Angie had struggled with, trying to gain more information about her condition, where there was no internet. And some of the first fruits of Planetree really were implementing community resource centers within hospitals that were first becoming Planetree member sites. To this date, we still see several of our hospitals with those community resource centers upon entry near the main lobby of the hospital. So it's easy to access these resource centers, even at a time where you're not a patient or not feeling ill, if you really want wellness information or researching something for a loved one. But beyond those resource centers, we really want to ensure that we are encouraging best practices for patients to gain information about their own condition. So we have had some trepidation, if you will, from folks, from clinicians at times about allowing the patient to read their own medical records. So some reports we've had are people believing that it's too complex and that most patients wouldn't understand what was written. Privacy regulations would prevent this from happening. Or I don't have time to sit down and read the record, and I'm not sure what patients would even want to know. So less than 5% of doctors, however, when this was implemented, reported longer visits when they opened their notes to the patients. And we also know that 77% of patients who reviewed their doctor's notes reported a feeling of more control in their care. Again, I can direct you to our website. We have a tab at the top with free resources. I will also reference this at the end of the program. And there is a great tool to help you implement a program in your organization to introduce the concept of open medical records to patients. So the whole idea of nothing about me without me. So knowledge is key in this, and allowing patients to see what's actually in their record. In addition to that, we really want to encourage bedside shift report that involves the patients and when they want it, their family members as well. So this allows the opportunity for not only the introduction for shift change, nurses going off shift, making that introduction to the nursing team that's taking over and coming on shift, a review of what information is hopefully on the whiteboard in the room, the opportunity to do some clinical work around checking IVs and dressings and reviewing, perhaps most importantly, the patient's goals for the day. So one of our sites, Good Samaritan Hospital, came up with a great acronym to help nurses through this best practice. And this is TAG, You Are It. So think of the children's game of tag. So reviewing with the T, the time of the last pain medications and reassessing pain scores, assessing abnormal situations that are presenting, reviewing those critical goals with the patient and the family, updating the whiteboard, reassessing medications, introductions of the incoming nurse, and review of tests and transfers and treatments for the day. We also want to make sure, even during this time coming out of the pandemic, that we are again seeking the involvement and the counsel of our patients and our families through our partnership councils or advisory councils. This, of course, has been much more challenging during the pandemic. So our current realities, we really want to review examples of partnership and actions. So continuing to develop the focus groups to elicit concerns and fears from patients and families about what is happening during the pandemic and post-pandemic. These focus groups, of course, can be held virtually, and partnering with co-design with the patients and families to address those concerns. Enlisting patients and families as partners or ambassadors. This has been particularly effective around getting people to get their vaccines. And then patients and families sharing their stories about what their new normal is. Particularly effective with patients who have recovered from the pandemic, who are able to communicate with patients who are currently hospitalized with COVID-19. Engaging patients and family partners to vet language and the tone of communications. This is so important. And coming back to those guidelines in terms of opportunities to maintain family presence, we have story after story of review with patient and family partnership councils of particular sites' restrictive guidelines around visitations, and how those were really unclear in many cases. They were, sort of developed and written internally and not maybe at first vetted through the patient and family partnership councils. And there was a real opportunity there to communicate much more effectively around those guidelines, which of course were very challenging when they are restrictive and people have a lot of questions. And they also responded much better to guidelines that were edited by patient and family partnership councils and other ambassadors who really could point out a situation where organizations were perhaps not explaining at all the rationale for some of the restriction other than, well, it's just the pandemic and this is what we're saying, so this is what you have to abide by. When they were provided with much more information about the rationale and the safety concerns, they were much more receptive. And also inviting patient and family partners to participate in simulations for telemedicine and provide feedback on the interactions. We have seen clinicians struggle with that transfer from in-person treatment to telemedicine treatment, and there's been great opportunity there to involve patient and family partners and ambassadors in this as well. So what do the virtual partnerships look like? Of course, taking advantage of free video conferencing technology and having support for your patient and family advisors who are participating in this, perhaps some of them for the first time, through Skype, Zoom, WhatsApp, Teams, etc. If this is not possible, and for many of our elderly patients, it may not be, using one-on-one phone calls and also small group conference calls that may not have that video component, but are still a great way to solicit input. Making sure that we have the opportunity, as visitors are allowed to return, that we have brief surveys and waiting rooms for both patients and visitors, and what that information can provide. So really questions about how they felt about coming into the office or the hospital, what could have been done to better prepare them, and what should be included in messaging, and how to change this process to be a better future. Also taking advantage of Facebook polls, WhatsApp, and meeting patients where they are within your particular community. So now last, we really want to reflect on our driving principles, that we see patients as partners. We view everyone within the organization, whether they're a clinician or not, as a caregiver, but also to be person-centered, we must remain staff-centered. And particularly coming off this extraordinarily challenging time of the pandemic, how we can really put our staff at the forefront of what we're doing. The impact of the pandemic has really thrust our caregivers into the community forefront as heroes. However, the longer than expected surges and longer than expected course of this pandemic has resulted almost everywhere in extraordinary staff burnout and staff members leaving their professions due to this. So in terms of support and recognition, we need care for the caregiver now more than ever. And we want to make sure that staff voices are amplified through engagement surveys and frequent short pulse surveys. We seek out any other avenues for input, be it suggestion boxes, open town hall meetings, opportunities to meet with the CEO and other leaders, make sure that huddles are taking place, that we have improvement events, and that we, of course, have visible leadership rounding. We have heard time and time again how important this is, such a critical component, that the leaders are on the floors where the pandemic care is taking place, and they're on a daily basis really cheering on those caregiver heroes throughout this pandemic. We want to make sure that there's the opportunity to build a community at work, and that there's resources to support this, that caregivers can exchange with one another through support groups, and making sure that we can honor their realities, that if situations are escalating, that we have the opportunity for one staff member to tap out another staff member and try and diffuse a situation. Also, many of our sites have implemented Code Lavender practices. So really those critical practices, be it healing touch, aromatherapy, a time for respite, that can fall under the Code Lavender category of caring for our caregivers. And making sure that there is the time and the space and the opportunity for support to share the emotional toll of caregiving, particularly during this challenging time where we have lost so many patients. A culture of wellness supports all of this. So making healthy food options available to staff during all shifts, making sure that workspaces are kept healthy, and that there are activities to promote healthy behaviors, encourage sleep, and encourage exercise. We also want to make sure we continue to cultivate a connection to purpose with our staff members. So really creating opportunities for staff to reconnect to the why of how and why they became caregivers. Part of this is through experiential learning. So staff continue to reconnect to that why, and they see experiences through the patient's eyes. So really looking for opportunities to take a break, re-engage with short opportunities for experiential learning, and have caregivers really walk in the shoes of their patients. And then also make sure that we create the opportunity for expression of all sorts of creative ideas that come through from our care teams. We want to make sure we are offering those tiny, small opportunities for reward and recognition. Thank you to our heroes. Thank you to our COVID warriors. Signs are popping up all over, but they are extremely meaningful. Seeing communities rally around the care teams through parades involving, fire trucks, and the local police departments have been heartwarming to the caregivers. And then also notes from school children. We have opportunities in some of our hospitals where these notes and letters from local school children thanking the care teams are posted throughout the organization, and they are really meaningful and heartwarming, and taking opportunities for little treats, little opportunities to cheer our caregivers on as well. And then involving, again, the community. These are chalk drawings that really the community became very involved in, but also care teams became involved in terms of cheering one another on. Very simple, very low cost, but a great opportunity for a caregiver who's coming on shift to walk through all of this encouraging words and artwork. This is from one of our VA sites as well. So really the time is now. It's not about a moment in time. It's an ongoing commitment to person-centered care, no matter what our circumstances are. We will come off of COVID-19, but as we all know, we are going to be faced with challenges post-pandemic, and we'll be facing, no doubt, new challenges as well. We want to make sure we are honoring the patient's needs for inclusion, their preferences, access to information, and involvement. That the care for the caregiver is of the greatest importance, and we really want to make sure we have that opportunity coming off the pandemic to plan for a person-centered future, how our new normal will look in engaging patient and family partners on all of our quality and safety teams, on our communication and ethics teams, and our community outreach efforts as well. As I mentioned, there are a number of resources. I don't know if you want to take a screenshot of this, but very, very easy to find on planetree.org. And also information, some of you I know are interested in our certification program for excellence in person-centered care. You can also access our certification manual here as well. So I wanted to take the opportunity to thank you very much for your time today, and thank Aileen and Rana for this opportunity, and hope that this has been of value to you.
Thank you, Karin, very much. I think we can, hopefully, yeah, you opened your camera again. If you want to unshare your screen so everybody can see you better. I just want to comment and highlight some of the many important points that you've covered in your session. And just as we have few participants who are not from a healthcare background, I just wanted to make the comparison and basically the relation of what you said as like the points you addressed and the interventions you shared that could be customized to many different industries. The same concept, just customize the idea to suit the industry, be it in education, in hospitality, in an organization. So the main points is including the customer who is the person, the patient, the student, the client, whatever the that person would be. Including them, involving them, not just informing and FYIing them, keeping them informed. And to do that and to make sure that our customers are involved, we need to take care of the staff. So being staff-centered organizations in order to make sure that they provide this person-centered care or person-centered service. I very much like the acronym of TAG You Are It, and I did take a screenshot of a few of those slides, and I'm going to be making sure that they get out to all participants. And I think the TAG You Are It can be customized to other industries as well, and it's a beautiful acronym that can be used. We'll just open the floor for comments, discussion points, or questions. Kindly feel free to unmute yourself.
Karin, I did send you a question through the chat box, but just to expand on that, does the business operate on behalf of patients in their discussions with caregivers or care providers? Is that what the advocacy is all about?
It's a good question. Thank you for the question, Ian. So we work in a whole host of ways, but patient advocacy is one of our main tenets. By all means, we are a not-for-profit organization, and the best example I can point to for recent patient advocacy is the reference to the opportunity to try and maintain family presence even during the pandemic. So we are constantly listening to the voices of our patients. That is also really what informed the National Academy of Medicine paper that I had referenced as well. So patient advocacy is indeed a big part of what we do. Okay. But staff advocacy as well.
Yeah, Dr. Rana.
Thank you, Aline. Thank you, Karin, so much for accepting to be with us today. That's really a privilege and an honor to hear all your comments, especially that I personally have experienced Lane 3 designation and the transformation it does to a practice. It's a real transformation that starts with the patients and never ends with the staff. So thank you for all the valuable comments that you shared today. I just have one question to you regarding the delays to access care by patients. We have seen during the pandemic not accepting patients because we were overflown or overburdened with COVID patients. So patients didn't have to start with, didn't have the privilege to be in a hospital during waves. Huge waves. So ICUs were booked, emergency room were booked, respiratory unit care were booked, and we started admitting patients to newly created units just to accommodate the overflow of the pandemic during high waves. What are your thoughts about this regarding how we can make this experience more patient-centered and more experience-centered, if I may say?
That's a really, really important question, and certainly what a challenge we all faced, and some areas of the world are continuing to face. And the very situation you described, for example, in India is being faced. So really the opportunity for community involvement, certainly, and I think we've seen, really the best of humanity rise to the occasion in terms of trying to help one another's neighbor and support them when they're really facing these challenging situations. But remaining person-centered when access is a challenge is tremendously difficult. So looking for opportunities for volunteer, for support, be it distribution of food and water to staff members, volunteering to help put up those makeshift hospitals. These are all things that, we saw, for example, the same of what you were facing in New York City, really during the critical point in New York City here. It was just extraordinary in terms of trying to gain access to an ICU when needed. And I think all of us coming out of this will have the opportunity to work at a local level, if this means voting in a certain manner, and really looking at how we can be engaged in our own communities to support our healthcare systems there and our providers to make sure that if, God forbid, we ever face another challenge of this scale, that we are more prepared and that infrastructure is there. But you raise a tremendously important point.
Thank you so much. I do agree. Preparation is key for another pandemic of that scale. And we need to take all the lessons learned from this one for the future. Thank you so much, Karin.
Thank you.
Any other comments or questions from the audience to Karin? Mariano, then Muhammad Susan.
Thank you, Karin, for this quite informative presentation. So, just to mix between a comment and a question. So I think what you're doing is basically to recover the institutions, to recover the people, you know, having facing this situation, you know, in the front line. Is there any special chapter for mental health recovery, from a special accent on that? That will be probably the first thing. And the second one is, some of the things that you mentioned, to me, they have to be there before COVID. So is this a recovery plan to come back to the previous situation, or is factors that you have seen quite, you know, damage during the year and a half, and then you put your efforts to recover those factors? Or how do you manage this? Because I saw that the patient-centered care was a key pre-COVID, you know, for many years. So is this something that COVID has emphasized, or is something that you have identified that is a core thing to access to recovery of organizations and the staff? Is that clear?
Yes, and you really raised some very important points. So we really want to emphasize that person-centered care needs to be a part of the quality equation during any times. And we really saw that there were some decisions many organizations made because it was such a difficult, stressful time, that were, you know, just really made without patients informing, and in many cases without staff members informing said decision, be it around maintaining family presence or access, or really looking to what staff's needs were. A lot of organizations made assumptions about not only what patients needed during the pandemic or could or couldn't have, but also you know, making assumptions about how to care for staff, and that they may have been very well intended, but that was not necessarily what was, you know, on the minds of the staff. I mean, story after story, particularly in many parts of the world, I know certainly here in the United States, the stress of caregivers about bringing the pandemic home to their family, and then also, you know, keeping their family going in terms of those folks who had children at home who were, you know, all of a sudden being homeschooled, really recognizing all of those elements. So, for example, organizations may have made assumptions about staff needs and support in one way, but they really needed support in terms of the fear that they had, and what you had said, the, you know, mental health and behavioral health consequences of going through this pandemic definitely needs to be a part of the equation too. And we are seeing more and more cases where we are going to have to address that, not only with our caregivers, but the community at large. Fortunately, I think we do have some great organizations who are very cognizant of that, and leaders. One I would point to is New York Presbyterian Westchester Division. Any of you, I believe, can sign up for their mailing list. They are a behavioral health organization, one of our gold certified sites, and have really groundbreaking approaches to mental health support for caregivers and the community at large. But keeping that continuum, making sure that person-centered care remains a priority no matter what the situation is. And, you know, really seeing that still being able to take place. I am going to point to Bellevue Medical Center in Beirut, where Dr. Rana has served in a wonderful capacity, seeing not only the pandemic, but the financial collapse, if you will, taking place in the country, and then also coupled with, you know, an explosion that was so extraordinarily frightening for the country and the community, and still seeing a hospital be able to navigate through, you know, a threefold crisis, if you will, and remain person-centered. So it's a challenge, but it really, it has to be a part of the quality and safety equation, just as infection control practices do.
Thank you, Karin. Hamad, please go ahead.
Yeah, hi, Karin. Thank you very much for this lovely presentation. I'm not into medical field. I'm in hospitality field, actually. But I want to share with you that we have the pleasure of hosting more than 150 between doctor and nurse in my hotels, because we have 3 hotels where I am now. And we are living their toughness that they have every day, for sure, because some of them, unfortunately, they've been as well COVID tested because of the I should say, the patient. So we are living this every day. But my question is, and I think I have to go back to Dr. Rana, I guess, because she's saying that it's over, everything is overbooked with a lot of patients and so on. But now we've been getting a lot of people asking to convert the hotel for rehabilitation now, afterwards. And this is a major thing. I've been asked, for example, to take one of my hotels, 90 rooms, is to be for like 6, 7 months, whatever. Is that something that could be raised up in the future now? Because we've been hearing a lot of people to come better. They need to really to be work on them, is to get better in health-wise. Could be with the breathing system, or could be talking, could be walking. I don't know. This is what it sounds like. So have you been facing such a thing like that? Thank you.
Thanks for the question. And my goodness, thanks for all that you're doing to support caregivers. That's absolutely tremendous. I do think we are seeing that. Certainly, we are seeing the very situation that you describe in a number of different areas of the world, and seeing how, you know, the hospitality industry has really been a critical partner in, you know, moving the dial forward in a positive way for that recovery. So I do think we are going on rest for caregivers, for isolation for those that had tested positive, then moving forward as makeshift hospitals when those ICUs were filled, and then now to that recovery phase. So yes, we have definitely seen examples of that.
Thank you.
Thank you, Karin. We have Ahmed Abdel Qadir. Yeah, Ahmed, would you like to ask the question, please?
Good afternoon for all. Thanks for joining this meeting, nice meeting. Special thanks for Ms. Karin. I just have one question as we are facing this pandemic. Actually, I am in hospital, which is Corona Center in Saudi Arabia. Already we are plenty accredited or certified. Since this pandemic, I saw that there is effect on implementation of BCC principles, especially related to patient families, caregivers, especially related to the visitation. How can we overcome this challenge? Because, as you know, this is regarding patient safety, infection control. There is many rules for how to join patient and family or care partner in one room, COVID patient in isolation. How you can overcome this? How can you maintain the BCC principles with this situation, especially regarding the patient and the family? That's my question.
Absolutely. Wonderful question. I very, very much encourage you to download those patient and family guidelines. If you are not able to, I think I can work with Dr. Aileen, Dr. Rana for your email address, and I can send those to you directly, or send them, make sure they have them and they can distribute there is a great new toolkit. So not only are the guidelines published, which have support from the Kingdom's ministry, by the way, so that's a good thing, but I know that there's still a lot of rules in place that have to be adhered to. So there is creative thinking around maintaining family presence, but also the new nursing toolkit that was funded by the American Nurses Foundation is a tremendous resource. So we want to make sure that you have access to that. And I think, again, all of us working at that community level, we have seen places change their policies. When really there was a conversation with the patient and family partnership councils, finally getting, typically it's, you know, with very good reason, the infection control experts involved, and really hearing out the opportunity to at least include that care partner. In July of last year, my mother had a heart attack. Unfortunately, she is recovered and she is 85. She's elderly. I went to Detroit, Michigan, where my parents are located. And fortunately, one of the only hospitals probably in the world, because we researched to find at that time hospitals that were allowing one visitor at least, and we struggled to find those. This hospital is called Beaumont Hospital, and for luck and the grace of God, I guess, I was allowed to be that visitor. But I can speak passionately firsthand how important that was, because my mother is a huge fall risk. And the nursing staff was already extraordinarily overextended. They were not able to answer call buttons. And she was in a non-private room with another patient. And that woman was also elderly and had dementia and Alzheimer's. And so had her daughter not been there, had I not been there, we probably would have had 2 residual cases of significant illness, injury, or death if the care partner was not there. So I think we're also going to be seeing, you know, the fall data that's going to come out, I believe, as a result of this pandemic will be extraordinary because care teams were not able to extend themselves so far. And also without that care partner there, you know, I think we're going to see a huge volume of information about the increase of falls, as well as many other consequences. First and foremost, probably the mental health consequences of both patients, families, and of course, caregivers with that restrictive situation, especially at end of life. You know, really the toll that is taken has been extraordinary. So these documents really do address all of that and can help you make the case maybe to make that change, you know, within your particular organization, community. We have a very fragmented system here in the United States. So it was really state by state, community by community, the restrictions within one county, within a state versus another. We're in conflict. So again, coming back to work on that local level, but making sure that you have those resources too.
Thank you, Karin. Dr. Rana?
Yes, Karin, thank you so much for bringing up the piece of the research and the connection of the research to the outcome. Actually, this comes very timely, and I want to really comment on what Mariano said earlier. Right now, we're conducting a research team. I'm partnering with the research team to really understand the effect of organizational support and the effect of self-confidence and learning related to COVID preparation on the emotional exhaustion of nurses who took care of COVID or highly suspected cases. So similar research as Mariano, and I agree with Karin so much, the research will inform us later on where we're heading. And this would definitely be a wealth of information and body of knowledge for people to craft solutions, standards, and guidelines for the practice and for better preparation. So we wanted to understand the organizational support and everything that Karin talked about in addition to self-confidence in learning, how this is affecting the nurses that are on the front line, taking care of COVID, highly suspected cases or infected cases. And I think this would be the progress in the future to really understand what happened and try to build on it. I'm not sure, Karin, if you would like to add anything, but this is the direction we're taking.
That's extraordinary. And I think continuing to, again, work, from the community level on out and broaden, our information base and our ability to listen to the voice of the patient on all different levels will be so critical in this, and the staff members.
Thank you for that, Karin. Ahmed, Ariane, please go ahead.
Yes. Do you hear me?
Yes.
Yes.
All right. Thank you, Karin, for the interesting presentation. I'm Ahmed from Dubai. It's for sure that the way the care is delivered right now has tremendously changed after COVID. I mean, we talk a lot about digitalization and etc. How there is one element that I'm worried about, and I see, is that patient experience gets a lower priority given the circumstance. What would be your top recommendations to C-level in order to keep patient experience as one priority? Because I think that is tremendously important. What would be your top recommendation to this level to keep the level of patient-centered care as it was, despite these change that we've witnessed?
It's a great question, and we do see this slippage, if you will, of the focus on person-centered care. So really coming back to that National Academy of Medicine paper, and we'll make sure we include that in the resources that I'll share with Dr. Eileen and Dr. Rana for distribution. That in itself makes really the strongest case for involvements of patients and family with those better clinical outcomes with this involvement. So that really speaks to perhaps folks who are making those decisions about postponing staff engagement opportunities or the Patient and Family Advisory Council or whatever it might be that's put off. But we really will, I think, be at a very negatively critical situation if that slippage continues, because of some of the examples that we've just shared. We will see those increases in falls. We will see more challenges with mental and behavioral health issues. We have to continue to put the patient and the staff member both at the center of how we are thinking. And making that case, I know, is difficult. Sometimes we have to draw back to, financial benefits of person-centered care as well. We saw during the pandemic, hospitals in New York completely were shutting down restrictions. And so patients who were ready to give birth were driving to the state of Connecticut, where the father or partner was able to be allowed during the time of the baby's birth. So decision-making can have a financial impact. Hopefully you can make the case without getting there, but as we all know, that is also a challenge with organizations facing financial constraints because of canceled elective surgeries and other procedures, et cetera. But really coming back to how would you want to be treated? Speaking to people in terms of their own personal experience, how would you want your mother to be treated, your son, your spouse, what have you, and really trying to get to the heart of what it's like to walk in the shoes of the patient and the fear and uncertainty that they face when family members aren't available to them and that support system. And again, the staff members, we are seeing that burnout and we are seeing people leave medicine in droves. So really, if you're not going to provide those person-centered practices in your organization to support staff, they'll go elsewhere where organizations are providing those opportunities to support staff.
Thank you. Thank you.
Karin, we have,
I'll make sure
one. Yeah, thank you for that. Karin, we have only one last question from Chris. Please, Chris, go ahead.
Thank you, Dr. Aline, Dr. Rana, and thank you, Ms. Jay. I wanted to ask you, please, a question. I work in the medical field as a pharmacist. We are facing now post-COVID several challenges, especially with the vaccine, the opinion of the people. We have so many challenges. People are asking us. I really love your presentation. It's perfect, and we should I'm talking about myself. I should really apply this in the future, especially helping the people post-COVID. But the challenge that I'm passing through now is that patients are asking us, which vaccine do you think I should take? Or I think that people with the COVID are having less confidence, unfortunately, with the medical care system. And there are people, and I think that when we inform our patients more about the vaccine, for example, if we say that we have this several side effect, this and another several side effect, they might think about them, and they might consider them even being afraid from them even before taking the vaccine. And this is discouraging people to take the vaccine. And some countries, unfortunately, this is in my opinion, are forcing patients to take their vaccine. In human rights, I think that this should not, it's more like to invite our patients to take or recommend the vaccine to a better health, but obliging patients to take the vaccine, I think that talking in human rights is not that accepted. But how can I, as a pharmacist or as a medical care representative, how do I have to put this confidence back to the patients for taking the vaccine, or maybe to trust more the medical field, because they are talking more about business, and this is challenging. This is challenging. What do you recommend? If you
Oh my goodness. Yes, that is an extraordinary challenging situation that you're facing, and thank you for all that you're doing to serve patients. Again, information, and what you already had articulated, being able to provide as much education to patients as possible in a realistic way. I think patients see through anything that is a shade of, trying to hide information. So you're right, being realistic about, yes, you may experience some side effects, but those are, much, much less than facing death with COVID. So being really clear and transparent about that. But the challenge, I think we are facing that globally in terms of getting people vaccinated who are fearful or have been provided so much misinformation through social media. It's extraordinary here in the US, the misinformation that is flying all over social media. And I know many other parts of the world. So really trying to dispel those myths. We have had one of our gold certified sites had a great campaign on the vaccine, and I can also send that information as well. And it was really coming to community leaders and having them talk to the community and say, so it was not just a medical professional, but it was actually clergy, local clergy that were very, very highly regarded within the community, rallying their community base to become vaccinated, demonstrating, a video clip of them themselves getting the shots and saying how important it was to not only keep themselves safe, but really speaking to, you are keeping others safe with this shot too. You are keeping your family safe, your friend safe, your neighbor safe. So going beyond how it's going to help them, but also appealing to their senses of how it's really helping others. If you're not going to do this for yourself, do it to help others. And that really did resonate. The other was access. I mean, finding, so not only having the vaccine available from, 7 a.m. to 3 p.m. or what have you, when people are working. So they may not be able to take off work and, go get it. So really having the opportunity for vaccines to be out in the community during times when people are maybe home and able to access it. We've seen vaccine clinics set up in the lobby of apartment buildings. So as people are coming home from work, they can get vaccinated, everywhere, every opportunity, everywhere. Now here, sports are starting to open up. There's vaccine clinics at some of the baseball fields here, so getting people the incentive. I don't know how much the incentives are working. I have not had the opportunity to read any solid data on that. I'm sure there is some, gift cards or what have you, but I think access, making that as easy as possible. And then also the dissemination of realistic information that's not going to gloss over. Yeah, you may feel a little sick afterwards, but that's okay. And the honesty, with the community and being able to come to people where they are.
Yeah, okay. Thank you so much. Thank you so much for your
Wonderful, Karin. Thank you. We have one more hand raised. Are you happy to take the comment? Otherwise,
sure.
Yeah, Sadiq, please go ahead.
Good afternoon to everybody. Thank you, Dr. Allen, and thank you for everybody watching us now. For me, I had COVID in February, last February, but I disagree with when they say that it is marketing or it is a business for a vaccine or to take our vaccination, the 2 shots. In fact, I was saved by God first and by the first dose of vaccination. If it is business, then I would have paid for that one vaccine. It was free. The 2 shots were free. Okay, and even the medication for which I was being admitted or given, okay, they were also free. So I don't know where is the point of business we talk about. This is what I heard many times from people around me who still are hesitant to take the vaccination. But I do encourage them to go for it because it really saved me and saved my family, if I do to say, and protect myself, protect my family from other let's say, environment around me. But still, I don't know where is the business. Even we are taking the shots free and we didn't pay any single dirham. For example, I live in Dubai and they are taking care of us and they provide us with the watches to go inside home in order to take care of ourselves. A lot of things we were happy with the things happened here. Really, every day they call us. Every 2 days they call us. How are you? Do you need anything? The support from all kinds of things they were providing us. Now this is what I'm talking about myself when I was at home. But what about the other people in the hospital? So I don't know where is the business. We were kids and we took our vaccination and we didn't have any opinion whether to say no or yes, we don't need this vaccination. And even my kids or all kids, we are giving them vaccination, So I don't know where is the business as long as we didn't pay any single dirham for that. Thank you, but I encourage everybody to protect themselves. Dr. Allen.
Thank you very much, Sadiq. Karin, I want to thank you so much. Deeply appreciate the wonderful presentation you made. It was absolutely incredible how you tailored it, emphasizing the meaning of person-centered care and putting tools at everybody's disposal. You have definitely captivated us all from the beginning till the end. Your presentation helped in no small way getting the significant message across Thank you again, and great thanks because you accommodated this session at very early hours in the morning.